Hey, good news, guys. If you've used the internet between 2006 and 2013, you may be eligible for a check. We've got information about that, as well as some exciting news about child tax credits, prescription assistance, student loan relief, and more. So let's get into it. First, let's talk about those checks. Google was accused of sharing search information with third parties, and although they did not admit any wrongdoing, they have agreed to a settlement. So if you used Google search between October 25th, 2006 and September 13th, 2013, then you need to take action by July 31st, either to claim your part of the settlement or to exclude yourself from it. If you do nothing, then you will automatically give up your right to ever sue Google for this issue or receive any compensation from the settlement. So it's important that you act fast. You can submit your claim form online at referheaderssettlement.com. You'll need to click registration form and then fill out that information. After you fill it out, you'll get an email with a class member ID. Now, it's very important that you follow the instructions in that email to complete your claim. If you don't follow all of the steps, you won't be included. So make sure you do all the steps. Now, although the total settlement amount is $23 million, there are a lot of people that are going to be included in this payout. So they're expecting that the average amount that will be passed out to people will be around $7 a person. I know that's not a lot, but I also know that right now every little bit helps because we're all hurting. So, speaking of help, let's also talk about the child tax credit expansion that was proposed in Congress this week. You might remember that back in 2021, the government radically expanded the Earned Income Tax Credit and the Child Tax Credit and started issuing parts of those credits as monthly checks to eligible families. This was amazing for low-income families. And studies have shown that these payments radically reduced child poverty and even unemployment. But, of course, that expansion expired and that program ended. And that's why several lawmakers have introduced the Working Families Tax Relief Act. This new bill would make those 2021 expansions permanent so that low-income families could keep receiving them. Now, I know that the biggest argument against this expansion is that there's a lot of people out there that think that it stops low-income parents from working. Interestingly, the data shows that the opposite is actually true. It appears that these payments made it easier for people to afford things like childcare and transportation that are necessary for people to be able to go to work. In a statement, the U.S. Senate Committee on Finance pointed out, quote, in July 2021, when the first payments under the expanded child tax credit went out, the unemployment rate was 5.4%. In December of that year, after 6 monthly payments had gone out, the unemployment rate was 3.9%. It's awfully hard to see how the CTC kept people out of the workforce in 2021. So if you'd like to see the Working Families Tax Relief Act pass, please reach out to your elected lawmakers and express your support for this expansion. We have over 100,000 subscribers on this channel, and if we all work together, we can all make our voices heard and help make this happen. So now let's talk about some prescription assistance programs that are launching. The Department of Health and Human Services has announced that eligible seniors and people with disabilities will now be able to get extra benefits to lower their prescription costs through the Extra Help program. And these changes that we're about to discuss will take effect starting in January 2024. The eligibility rules will be expanded to make more people eligible. So under the new rules, you can be eligible for the full low-income subsidy if you have an income of up to 150% of the federal poverty level and meet the other eligibility criteria. The CMS estimates that around 3 million low-income seniors and people with disabilities will save up to $300 per year on average through this expansion. Now, speaking of seniors, the CFPB also estimates that 27% of people who have co-signed student loans are over 62 years old. There are over 2.8 million American seniors who currently owe student loan debt, and most of those loans belong to children and grandchildren. And as a co-signer, that means that their credit could be impacted if their loved one doesn't make those payments on time. And I know that there are many seniors out there that are barely scraping by right now. So student loan payments have been paused for 3 years, but the government has announced that those will begin again in October. So if you owe loans, or if you've co-signed for someone else who owes loans, then you can call the Student Aid Relief Line by our sponsor, CareConnect USA, at 888-201-0431 for assistance. Now, they have experts standing by that can help you navigate all of the relief options that may be available to you. Again, that number is 888-201-0431. Seniors are also being hurt by the Medicaid disenrollment. President Biden actually came out and asked several states to slow down their reviews because so many eligible people are losing their Medicaid coverage. Over 1 million Americans have been removed from Medicaid already over the last few months, and many of them were still eligible. They just didn't get their paperwork done in time, or they weren't notified, or something went wrong in the review process, probably because states are busting out these reviews so ridiculously fast. Now, this is a personal issue to me. I know and love at least one vulnerable senior who has lost her Medicaid coverage, even though she is absolutely still eligible. This dear friend of mine has a number of health challenges that make it really difficult for her to understand and navigate the paperwork and the bureaucratic process required to re-enroll. And I live too far away to be there to help her personally, so I worry about her all of the time, just like I worry about all of you. So please, if you were on Medicaid and you're still eligible, please reapply. If you are on Medicaid and you haven't gone through your recertification process yet, please make sure they know how to contact you and that your phone number and address are up to date. And if you are a senior or a person with a disability and you're having a hard time with that process, the Area Agency on Aging or your local senior center should be able to help you with that process. If you are no longer eligible for Medicaid, please check out our video about Medicaid alternatives. There is still other help out there. Please seek it out. And while we're talking about healthcare, please watch out for healthcare scams. I saw some really scary news reports out there about how healthcare agents are falsifying paperwork and enrolling low-income people in ACA plans without their consent. In Florida, at least one homeless person lost their access to the Ryan White healthcare coverage and then couldn't get their medications because some agent came along and got their information and falsified a healthcare application. In the most recent report, the federal agency in charge of overseeing the Affordable Care Act marketplace said that they had received over 25,000 complaints in a single year from people who were enrolled in policies without their consent, or who later found that an agent or a broker had falsified information on their application. Now, I know that this may not seem like a bad thing on the surface because it means that statistics are showing that more homeless people are getting health coverage, and it seems like that should be a good thing, right? It is fraud, and it is very damaging to the people who are affected, because when someone enrolls in healthcare through these plans, they can lose access to the free coverage they're already getting from low-income programs. And it can make these people unable to get their medications or see their therapists, and it can cause huge problems. There are doctors and medical professionals who are reporting huge interruptions in healthcare services that put people who are already vulnerable at risk of relapsing into drug use or mental health crises or other health crises because they can't get their diabetes medication and other important things. So if someone approaches you about enrolling in a healthcare plan, especially if it sounds too good to be true, please don't sign anything without carefully considering how it may impact your other benefits. Many of these agents are paid out on commission, so they make money when you sign up, and they don't really care. They have an incentive to lie to you. So when in doubt, please consult with an impartial third party. Somebody at your local area agency on aging maybe, or somebody at your doctor's office, or another community service provider who can look that over and make sure that you're making a good choice for you. That is so important. Sorry, I'm getting really worked up. I saw some really crazy stuff out there this week when I was preparing this video. So in local news, we have some incredible updates for a lot of states. This was a big news week, guys. We've got updates for Alabama, California, Florida, Georgia, Illinois, Indiana, Louisiana, Massachusetts, Michigan, Mississippi, Missouri, Montana, New Mexico, New Jersey, North Carolina, Ohio, Oklahoma, Pennsylvania, South Carolina, Tennessee, Texas, Utah, Vermont, Virginia, West Virginia, and Wisconsin. We have found information about new guaranteed income programs, how to get free air conditioners and free fans, how to get free appliances, refrigerators, and washing machines even. And in one state, we even found information about a legit stimulus check. Unfortunately, I have been sick all week and I can feel my face like hurts. So I need to stop recording today. But you can find all of these updates on our website at lowincomerelief.com/news or by using the direct link below. If you just go to lowincomerelief.com/news, you're going to want to click on that first article that appears on that page, because that'll have all of our news updates, and you just want that most recent one to get the information from this video, because obviously this is our most recent video here today. Sorry. Thank you so much for watching. I appreciate all of you, and I really appreciate your support, because you watching these videos means that I get to spend all of my time helping people, and I think that that's really great. So thank you all. I will see